no, I got to get the weed whacker to go with it. This will be a gift for many, many occasions. Approval of the minutes. I looked through the minutes and I thought everything looked in order. Unless anybody has any comments, can we approve the minutes?
We
May I have
cannot
a motion to do that? Oh, that's right. We can't do that anyway. Okay, right.
So that will
All
carry
right.
over.
Should we even listen to the rather various reports? I guess we can.
We can listen to all the reports. Yep.
Okay. Is anybody here to give an inspection report?
Yeah, I can do that. We've been doing an abbreviated version of the restaurant inspections for those that are open, and it's been concentrating on making sure people are following the proper CDC and health department protocol with masks and distancing, not serving inside. We're getting good cooperation with the not serving inside. However, there's been a lot of problems with people not wearing masks. We let them know. That goes as far as the food stores, the corner stores, and also we had an issue with the gaming machines they use. These serve games of chance, but we don't really know if they're legal or not. The state's taken a little wishy-washy approach on those. And those sometimes they'll have like 3 in a row, and then people stand around to watch other people play. So we've been doing reminders to stop that. And then some of the stores cooperated with moving them in various different parts of the store so that people aren't.
Well, I don't. Maybe maybe Fred Latchey can tell me this. My understanding is, I mean, regardless of what the rules are, if a store doesn't want you in there without masks, and you choose not to wear a mask, owners of private property do have the right to ask you to leave, do they not? You know?
Yeah, sure. I mean, you can limit who. I think the comparison that's constantly made is like the no shirt, no shoes, no service.
Right.
I mean that it's there's limitations of how you can remove people from your property.
Oh, sure. You can't do it based on the color of your skin.
Right.
Of course. Yes, I understand that.
Right. And that's true as well. I mean, it can't be discriminatory, but it also, you have to be careful on how you enforce your policies if you're a business. But with this, if it's, someone standing at the door, like we've seen in a lot of, videos online and things like that, where people are telling people they can't come in, and then the person, I saw one woman saying this is a HIPAA violation because she said, they asked her, well, what's your malady? And she's like, I can't tell you that's a HIPAA violation. And I'm sitting there. And my wife, who's a nurse, I'm telling her that we're more offended by the HIPAA, the improper invocation of HIPAA than the improper invocation of the Constitution. So.
Right. Well, the reason I ask is because I have a friend who works in a small store, and they had a policy. You had to wear masks, and people wanted to argue that they didn't want to, and I assumed that even if it wasn't an official policy, if it was like optional, that you would have the Now, Fred Sheeler, can you clarify something for me? Because personally, I walked into Dunkin' Donuts in Ole a few days ago where they were preparing food, and I was just getting it and taking it outside. And there was one woman in there with no mask on, and several others with their mask like this. And, I very politely pointed it out to the manager, and she tried to argue with me and said, well, technically it wasn't really required. And I told her it didn't really matter, that if I felt uncomfortable, she should do what she needs to do for customers. But technically, if you're in a spot where you're preparing restaurants or preparing food, must you wear a mask?
The protocol that we've received from the Department of Health says that the employees must wear masks.
Okay,
and
because there was that thing you sent out just a couple days ago. I guess Michelle sent it out from this, from the state, I guess. And I was looking carefully in here to see if they specifically addressed that. So
that what I was talking about with the health inspectors going out, that was more related to the employees not wearing the masks. I mean, they are coming across customers not, and then some
Right.
employees and owners not enforcing it, and they're
Yeah.
lightly telling
the-
them that they should.
The other problem too is you got too much of these.
Yeah,
these
there's also
Yeah.
not wearing them properly.
Right.
They're making sure that guards are in place, like plexiglass.
Right.
So they let people know, and then maybe the next time they go in, they have those. So it's helpful that not everybody understands that's a simple thing that they could do.
Okay.
That's supposed to be required.
Right.
But they are told, and the next time they go by, they're keeping track of who hasn't cooperated. But it seems like if they mention it to the people, next time they check, they're more in compliance.
More compliant. Good.
Yeah.
All right. Anything else on the subject of inspection report?
Now we're getting into the sidewalk cafes starting up. So the
Oh.
city was pretty proactive with coming up with a relaxed type of permit process.
Oh.
So that's just starting up. A number of them have already done it. So that we just have to make sure that they're doing the social distancing and following the procedures, but also not encroaching on the sidewalks over the required limit of 4-foot space.
All righty. Jeremy, could you give us an update on how things are looking generally for the city emergency services? Last time we had a lot of concerns. I hope things are better.
Yes, at this point in time, the last 5 days or so, Berks County's been under 20 for cases, for additional cases. So we are seeing that downward trend. At this point, we've been working with the administration to prepare for employees to come back to City Hall in the near future, and to make sure that the employee protective measures are in place so that our employees feel safe, and that there's adequate masks, hand sanitizer, social distancing, things like that. So Public Works has been kind of leading the charge of installing some of this equipment to make sure that we're providing separation. And obviously through Jamal and Fred's department, I know some social distancing concerns have come up there with their number of inspectors. So these things are kind of a work in progress, a lot of moving parts, but I think we're working in the right direction. The managing director had a good idea, which we spoke about early on, which was to bring the employees back of kind of like an employee opening, and then we would let the employees kind of settle in. And that way, hopefully during that interim, we can work out any problems that we identify before we reopen to the public. So I think that's probably the best.
Are they setting any standards regarding taking of temperatures when employees show up in the morning?
That was mentioned. I mean, obviously, being government, there's some theories here that we're exempt from that level of surveillance, I guess you could call it. But we work closely with the new HR manager to develop a screening tool for division managers if employees feel sick. And obviously,
Yeah, I mean, it's so simple. I mean, I would think, why not? You know, I don't know.
Yeah.
Even if you just catch one person with a fever that didn't know it or something. You know?
I know that through HR and legal has to review it as well, but there'll be an internal questionnaire for an employee to screen them to determine to make sure that obviously that they are well, and if they're not well, then it provides some additional direction. So that's something that we took care of, and it's been is going to be reviewed by legal. I would imagine very soon, so it can get disseminated in its finished fashion to department heads.
When we spoke last, over 2 months ago, the big concern on everyone's mind is whether you're going to have enough equipment, and it was pretty tight for a while. Is that like a non-issue now, or where do you stand on that?
We are. I mean, we're managing our burn rates effectively. We've actually seen a decrease in the amount of COVID patients I think we're dealing with pre-hospitally. And Dr. Devhoff, this is Kirk Litzenberger, who's the Deputy EMA Director, so he's been extremely helpful. Kirk's been handling all the logistics, so he handles all the personal protective equipment. We continue to manage our burn rate, which has been very good, actually. We've fared well. We are still waiting on actually 9,000 N95 masks that we ordered in March, and that was directly from 3M, but we keep getting bumped back. So we have adequate, but we definitely, the 3M is I think just a better quality mask. And that way we don't have to worry about rubber bands breaking. They seem to hold up better.
What about from the standpoint of personnel? I know early on there were concerns that if someone were to be exposed, they'd have to self-quarantine, and now suddenly they're out of the rotation to drive the ambulance or whatever. Have you had much trouble with attrition of personnel?
No, we had one member that was sick, and he was able to, after we arranged to house him because he couldn't find a spot, and he has young children, and then he managed to self-quarantine at a family cabin. So he was the only member that became sick with that. I think our members have been pretty diligent, with, and a little bit of luck, obviously, on that side as well.
All right. Or anything else you want to add?
No, I
Sounds like things are under control, at least.
Yeah, I think that, you know, again, a lot of our angst, and I think, you know, we had this conversation last time. I feel that, you know, not only that handicap we spoke about earlier, the Department of Health, but, you know, from our county EMA, they have been helpful as far as personal protective equipment. But realistically, what we've done within the city of Reading has all been through us, our planning and things like that. So I was kind of surprised that the county didn't push a little bit more information down to local emergency management coordinators.
On that question, I have a question that I don't know the answer to. Someone here probably does. As you know, we spoke, you know, multiple times last time about why weren't we getting this information. And the answer is because we didn't have a real board of health with enough people to staff to do the contact tracings, etc. And then after we were making a big deal about that, a number of weeks ago, there was an email sent out. I received a copy that said the state had reconsidered and that they were willing to have one person assigned in the county, and they would give that information to that one person. And I said, well, I don't think that should be the city. I mean, you know, it has to be somebody in the county. And then I later got somebody wrote, I don't remember who, to say after they heard what the conditions were to receive that information, they declined. Anybody know any more information on that?
Yeah, I reached out to Sean Hart, who's the Deputy Emergency Management Coordinator for Berks County, and I spoke with Elizabeth, who brought this to my attention. I think Michelle. It was a big string of emails, basically.
Was that
disseminated that.
talking about Elizabeth Kraft?
Yes, yeah.
Yeah,
the two of us spoke. Michelle's email and spoke with Elizabeth, and she said, "Is this what's going on with this?" So there was all kinds of, I guess, finite requirements or tag along regulatory issues, and the county basically threw their hands in the air and said, "This is too much. I don't know if we can do this."
Yeah.
So yeah, that's how that never happened.
Yeah. Because that leads then into the discussion about whether Linda Kelleher had sent some information to me along to Michelle. Maybe you all received it as well. And there were links to 3 other municipal health departments, Bethlehem, Allentown, and York. And when you look there, their departments were arranged a little differently, and it looked like they had more robust services, but they all have quite a bit more staff members than we. I saw the place in York had a budget of $1.3 million, which they got from state, federal, and some philanthropy. So I guess that's a big question, and obviously, you know, it's very hard to ramp up services if the money isn't there to do it.
Sure.
Did you understand? I wasn't sure I understood entirely what point Linda was driving at, or what she was suggesting. Anybody here know? I should walk across the street and ask her tonight.
She's still at City Hall. There's a meeting at 5 o'clock.
Oh, okay.
I think at the time when we were looking at that, there was a couple of things. The Pennsylvania made some amendments to their Board of Health statutes that we need to now apply to ours. So that got us researching what others were doing. And that's when we found the others who have the Department of Health's And that's why they were getting more information from the state, so they had more specific information about their municipalities. So it was kind of a combination of both of those things that sent us searching.
All right, because it wouldn't be real easy to just say, hey, let's turn this into that tomorrow.
Oh no, it can't be tomorrow.
Yeah, okay, all right. Yeah, and it appeared as though they had more comprehensive services, some of which, remember, they had immunization services and other health services. Looks like some of it may have overlapped with the Cook County Wellness too. But you'd have to sit down and take apart.
A lot of it also overlapped with what we call property maintenance. It's the health inspections, it's the property inspections, it's trash, those kinds of things as well. So it was kind of a combination.
Maybe on a much easier level is the question that we've bantered around before, and that is, should we have a full-time health officer? And Shelley, you know better than I do as to what it was like when we had one, because I was never around when we did.
Well, I did know what it was like when we had it, but I don't know what the effect now is, and that Jamal and Fred Sheeler probably could speak to that now that we don't have one.
Right.
How operations have been affected by that, and whether or not we need to have one.
Well, I can say I wasn't here when they had one. That was a year and a half, almost 2 years ago. It was very part-time. It was only a few hours per week.
Right.
And it was down to that person just reviewing handicap parking applications.
Yeah.
All of which eventually did get approved one way or the other.
Right.
So even the ones that he asked for further information on came back and got approved. So now that's just handled. If the state approved it, we approve it.
Right.
So that was the only thing that any of my staff can remember him doing.
Yeah, I mean,
I think
I was not around on the board, but I knew Jeff Hassel. Now that goes back quite a way. And he came in and did all the work comp stuff for the city, and his role expanded. But it would seem that's just as easily handled privately.
Yeah, and like I said before, the health officer used to give the flu shots to employees every year. He used to make sure that the wastewater treatment plant guys and gals had all of their hepatitis and all of those kinds of things. So he did a little bit more than just parking applications in the past. So that's why I said I'm not sure if we still need that, if it's better to not use our own and to have them go to other professional offices. That's what I don't.
Like there's one thing without it.
Compare that.
Money. I don't know how much was outlaid in expenses for that.
It is what we're trying to plan and do now, actually. And Fred and I spoke about this earlier, pre-COVID, and it became more important to us to understand the role of the health officer, especially during the COVID time, because it could have offered us a lot more information. And as a matter of fact, at a certain time, we were referring to the health tower to help us with guidance on some of the operations and how we will be able to handle it. This is a very critical component. It's driven by the welfare of the employees, as well as how we will be able to be placed in view of the health department in Harrisburg. So it will be revisited again, but at the same time, we will probably have to be cognizant about whether this is something that can be offered as a full-time position, or we would need to resort to a third party, an outside third party to do it.
Yeah, I get the other question is how easy would it be to find somebody willing to do that? You as you had said, Michelle, it might actually be easier to contract with one of the hospitals to just provide a person. The problem today is just about everybody, and this is going to be even more true, I think, as practices recover from this. Trying to find a physician that is independently owned and operated is going to be very difficult. Probably 90% of doctors today are salaried by a healthcare system. So, you'd almost have to be, because I think that was one of the problems with our last health officer, because then he ended up being salaried by Reading Hospital, who didn't, I guess, particularly want him coming over here and spending his time doing, moonlighting or whatever you want to, maybe that's not the right word. But.
And that last doctor, he did not do any of the immunizations. He wouldn't do them.
Oh, okay.
No,
Yeah, Eve Kimball, who had been in the Board of Health, that goes back 15 years. She was appalled that there wasn't a health officer. I mean, I guess back in the day, the health officer would come to all of our meetings. And so there was more, there's more continuity between when we met and what was happening day by day. So, I mean, ideally, yeah, it would be great to have one. I don't know if you need one full time unless his role is vastly expanded. Do you have any idea what, back in the days when he was doing everything, how they were paid for that, or how much does the city even have a budget for something like that?
I don't know what the budget was, but I know he was part-time. Dr. Hassel came here, I believe, 2 afternoons per week for a few hours, but I don't know what his salary was for that.
The last part-time, I believe, was $20,000 per year.
Oh, okay.
For relatively small amount of time.
Well, I remember he used to do the work comp stuff. What did Hallman do? Was he in the personnel office?
Yes, he was our risk and safety officer.
Okay, I remember he used to deal a lot with the injured individuals. I never quite understood how his role in it. Okay. All right, I don't know if we can discuss that much more at this point. Any other thoughts or on the matter? Then I guess we can go over to see old business, health education, epilepsy. I think we should take that off. The only reason it was on the agenda is because we were under the understanding that there were some women who was badgering city council to talk about epilepsy. And they said, well, come to us and talk about it, which makes sense. But she never showed up.
Correct.
So we can take that off.
Okay.
Health code amendment, we already spoke of that we need to do further work on that. And Charlie, at some point, it'd be a whole lot easier someday when we can sit next to each other. If you want to sit down and look through the stuff, try to make some sense out. I mean, I'll be happy to do that with you.
Okay.
I think it'd be a lot easier to do that than to sit here on a screen. Berks Teens Matter, is that kind of on hold, or I can't imagine what's going on there with school closed, or what do you know?
What I know, they are working in cooperation with the Planned Parenthood, has a similar type of health resource center that they do in different schools than Reading High. So the people who are in charge of both of those resource centers are now doing virtual visits. So since the kids are not in the school building, if they have an issue, they do Zoom calls, and they have open forums where you can kind of come on and ask questions, or just have discussions. So they are not completely in limbo. They're doing.
You get the impression that they're fairly busy, or they're still getting some.
I think they're still getting it's obviously not as many as if you have them in the building, but there's still some teens who are reaching out. So it's good.
Alrighty, antibiotics and bodegas. Yeah, and that's a tough one to crack. We talked to some people and found out that it's really in the jurisdiction of the FDA, and unless we're going to start trying to run around and report every one of these, but then the problem is they'll probably just close them up and open them up again. I don't know if there's a whole lot we can do about that. We talked about trying to get an educational campaign, but that's largely just say you shouldn't be using antibiotics without a doctor's prescription. But heck, half the people I know who are intelligent people and know better pester their doctors for antibiotics when they don't need them. So that's a tough sell. The Lead Abatement Coalition. We went to that meeting that they had with, this is the RAWA. I guess a lot of that is now kind of on hold as well. I have not heard much of anything about that since we were there.
Bill Murray, the executive director of RAWA, gave an update to the Environmental Advisory Council at their last meeting. And he is working with the local chapter, I believe, of the NAACP for a proposal to move a program forward, kind of like a pilot of how it would work in Reading to do a few things. So if I have additional information on that, I'll get that to you when I receive it.
Yeah, when I was thrown off, when I attended that meeting, I thought this whole meeting was going to be about getting lead out of the water in the city of Reading, that we had a lead problem with paint. But that, as you know, it wasn't really the crux of most of the discussion. But okay, well, let us know. We can talk about that next time. Another thing I'd like to talk about is the addition of some other members. Dr. A had said she had a woman, I don't know if she was a nurse or whatever, was very into that. She was very dialed into the community. I think she was Hispanic. and she thought she would be a great person to join the committee. I have not heard anything more about that. I shall email her to find out if she is making any progress there, because we really would like to expand the roles. And we have a large Hispanic community. It'd be great to have somebody who can more easily connect with them, perhaps. I hope I can say that. And I think that's about it on old business. Any new business? Or anything else anybody would like to talk about while we're here?
Yeah, Jamal.
Yes.
I do have a point that I would like to bring to your attention. Considering that the next meeting is supposed to be on August 4th, it will be very timely to discuss and bring this to discussion right now. You may have heard, and if you haven't, I'll be the first one to bring it to your attention, that the HUD program, the federal HUD program, approved today for the city of Reading about $1.4 million additional funds for what's called the Emergency Solution Grant, ESG program. And that is a program that deals with rapidly housing and homelessness. The speculation here is that as of July 24th, when the moratorium for eviction is lifted, we are anticipating an increased number of homelessness within the city itself. And that's what I would like to bring to this board and see if there are anything we need to address all together as a board. And are there any certain precautions we need to take with us and basically see if there are some guidelines we can benefit.
Well, now the money, what is the purpose of the money? I mean, is that to be distributed to do what?
Okay, so the HUD, as you may know, has several programs. The city of Reading has an access to two programs. One of them is called the ESG, which is the Emergency Solution Grant. And the other one is CDBG, or Community Development Block Grant. We've received some funds back in April, or allocation of funds, and they were actually quite sizable, about $2.2 million. But today, the federal government allotted for us an additional specific $1.4 million for, again, the ESG, which we have received prior to that about $750 million. So at a total of right now about $2.2 million. And that this program, the ESG, or Emergency Grant, mainly addresses homelessness, housing, and issues of that nature. And speaking with Kimberly Talbot about who she heads the Human Coalition, the Human Relations Committee, basically indicated that we are going to see an increase in number of reporting homelessness evictions.
Well, was there a sense or a way of how they would use this money or distribute it to make that situation better? Were they going to give rent rebates to people, or were they going to pass out money? Or, I mean, has anything been set up to figure out how to deliver the money to make it?
All of the above. Basically, we are trying to put a program so that we can pay for rent rebate. We are also trying to find out those who are evicted, how we can provide them with rapid housing and be able to do so. And if there aren't any of those, then basically we'll be able to find places such as the shelters, the house, and if that also does not, it comes to capacity, then we are looking at other alternatives. And these are alternatives right now can be very challenging because we may be looking at hotels, we may be looking at if schools are not open, the stadiums in these schools. So there will be plenty of plans, but my concern here is that if we can put a proactive approach to all of this. And that's one of the things that I would like to discuss.
Tell me again the date when the, you know, when the rent forgiveness, or what do you call it, ends. Is that the,
Say that again.
what's the magic date when the date ends, you know, where you.
July 24th is the last day, and at that point in time, the court
So
will
back time of a few weeks until you see some. Now, I assume that some committee or some group of people is sitting down now and trying to figure out how to distribute this money and to do that.
That's correct, yes.
And who is that group that's doing that?
That is the community development group. That's us.
Okay. Well, I mean, there would certainly be some aspects of that that impact public health. In what way do you think we could help as a board?
Well, you've said it. There is an impact on public health. So are there any precautions or certain criteria that we should look for? Because the discussion was that how do we qualify and how we'll be able to put an emergency plan to deal with this. And obviously this situation expands over multiple aspects of it. And there, some of it is going to be the financial part of it, and that is a limited part, but also the health, the public, the housing of the individuals, how the process is going to be handled. Is it going to be handled legally before it gets to court or after it gets to court? And depending on the organization you're dealing with, like for instance, Burke's Coalition for Ending Homelessness will not deal with families until they receive a court order. In another sense, an individual or family cannot be considered evicted homeless family unless there is a court order doing so. That's the time when Burke's Coalition will act on it. Whereas in other organizations, it may be easier not to do. So we are looking at an estimated number of about 100 applications per day rolls around at that time, which is a huge number.
Oh, would this, in other words, the people who were in a bind and couldn't pay their rent would be required to apply to get the money?
I pick up on. Say that one more time.
Yeah, some of your voice breaks up, so I'm having a little bit of trouble catching everything you said.
Okay.
So in other words, the money that will be distributed would, in order for someone to receive that money to help defray some of their rent expense, they would have to apply to get it.
That's correct. Yes.
Okay.
Yes.
Well, I know, the subject of homelessness has come up before at our board meetings a few years ago when there were a lot of problems with people defecating outside. And I know we had a number of people come in from some of the various homes at the time, some of the shelters, I should say. I mean, if you think, I assume people have been starting to talk to our current existing capacity for managing homeless people, right?
That's right. Yes. Because we are trying to team up with the county, as a matter of fact, because the county is receiving another $1 million for the same purpose. And we are trying to develop a program encompassing all. But I thought if you or as a health board here, there are certain specific points that you can provide us with, we will greatly appreciate that.
What do you mean by, I'm not sure I understand the last.
If you have any advice that we can take into consideration, that would help. That would be very helpful.
You mean advice as far as, I'm not sure that I understand. I mean, advice about health, about the health of the health situation among the people?
I would say that it would not be an advice about health. It would be an advice about if we are encountering that number of homelessness. One of the things that we should take into consideration is that assuming we could not house all of the individuals, there will be people floating in the city, taking shelters on the bridges or in abandoned properties. What can we to? Is there anything you can advise us to take care of health-wise? Is there anything?
Well, I mean, if suddenly people are setting up in makeshift encampments, I mean, yeah, I guess we and the board could certainly give advice on sanitary conditions and making sure there are job johnnies where they need to be and that sort of thing. I don't know if that's what you mean. Because when you start having people live in those kind of squandrous conditions, I mean, you do worry about breeding disease. If you remember, there were supposedly reports in San Francisco of some bubonic plague showing. I don't think that's a big risk, but certainly it could be a potential help.
That's okay.
Would it be helpful, Jamal, to have Dr. Dadoff speak with you and Kim Talbot?
That will be. I welcome that idea. Absolutely. Yes.
Do that.
Yeah.
Well, the other thing is it might not be a bad idea to get Dr. A in the mix too. The other doctor on the Board of Health is an infectious disease expert. She's board certified in infectious disease. So when she starts talking about infectious disease, you know, she's got some clout behind her. I'm a retired orthopedic surgeon. You know, I can saw bones together pretty well. But it would be good. I mean, we're very fortunate to have her on the board because she's exactly the person who can give you good advice in these times.
Okay.
The other thing is she works out of the community general hospital. And I don't know what services are down there. Obviously, if there are a lot of people living, you know, in encampments downtown, getting health services to them would be difficult. All right. Well, I'd be happy to meet with you. I can talk to Dr. A. Maybe we, you know.
I'll get in touch with you. In fact, I don't know if it's too soon, but tomorrow I do have a meeting with Kim Talbot about, I think, 1 o'clock or something like that. But we will discuss it and then we'll get.
I'm going to be on most of the morning. I don't know if I'd be back by 1 now, but okay.
Okay. All right. We'll get in touch with you.
Okay.
Thank you.
Else for the good of the order? I suppose not. Well, then I guess we can adjourn. I guess we'll keep our next meeting for August 4th, but if there's some reason to meet sooner, we can certainly do that. And we can address some of these other issues as they come up. I mean, if something comes up, I mean, you can always call me or email me and, you know, I can put my head together with Dr. You know, we can just have a little mini huddle or something. All right, well, I hope this doesn't come back in spades when we get into the fall months. I have a feeling it's not going to come back big time, but who knows? Okay, well, if that's...
Thank you.
May I have a motion for adjournment?
I'll make a motion that we adjourn.
Typically do that either, okay, because we technically never start. Okay, well, thanks everybody for coming. Hopefully we've got some information across and see you next time.
See you.
Okay, stay safe, everybody.
You as well.
See you,
Thanks.
Thanks.
Bye.